right, we are back here. Good morning, Arkansas, in the River Market Studios. We are happy to have the advanced practice nurse, CALLIE FLETCHER, here at CHI St. Vincent Family Clinic, talking about allergies this morning. Good morning. I'm going to learn a lot more about allergies, I think. As I get older, I feel like I'm getting that. I get that more in the springs. It can change with age.
Absolutely.
You can go through your childhood, not have it, and then all of a sudden develop it.
Sure, absolutely.
What is allergy rhinitis? Did I say that right?
Sort of. Allergic rhinitis, yes. Currently 40 to 60 million Americans are suffering from allergic rhinitis right now. Seasonal allergic rhinitis is when you have an allergic sensitivity to airborne mold spores or pollens from grasses, trees, and weeds. Allergic rhinitis is when your immune system overreacts or is overstimulated by something in the environment that typically wouldn't bother most people.
And so your body, how does it react to that?
Common symptoms include itching of the eyes, nose, mouth, throat, itching of the skin. You can have watery eyes, runny nose, and sneezing. Later symptoms that develop include congestion, ear pressure, or fullness. You can have circles, dark circles around your eyes, puffiness underneath your eyes, cough, things like that.
A lot of people talk about in the springtime, you see that pollen everywhere, that green pollen, but that's really not the stuff that you're allergic to. There's other stuff you can't see in the air.
That is correct, yes. The pollen that ends up on the cars is actually, those molecules are too big to actually get into your sinuses and wreak havoc on you. It's the smaller ones that we worry about.
So you talked about mold spores. I take it that that's quite common when it's very rainy and damp out?
Absolutely, especially this time of year.
And so we start to have a reaction to that. So what do you suggest for patients that are struggling with, should I call it allergy rhinitis or just call it allergies?
Sure, yeah. The best thing to do is to avoid the allergen that's causing your symptoms. However, I tell most of my patients that they're probably just allergic to Arkansas, and unless you plan on moving, you can't really get away from them. So the next best thing is to reduce your exposure. If your symptoms are mild, you can get an over-the-counter nasal spray, wash for your sinuses. That'll help the mucus. You can actually make some at home if you want, with a cup of warm water, a half a teaspoon of salt, and a pinch of baking soda.
Half a teaspoon of salt and baking soda?
Pinch of baking soda.
A pinch of baking, is that just mixed with
the cup of warm water?
Never heard of that.
Yes,
and
absolutely.
That helps relieve the conditions.
Yes, sure can.
Okay. Now, I guess you can also go to the pharmacy and get something that's over the counter?
Absolutely. If your provider decides to prescribe medications for you, it's usually based on how severe your symptoms are, your age, and other chronic conditions that can come along with allergies, such as asthma. There are 4 types of typical prescription medications that we use for allergic rhinitis. The first being antihistamines, which are found over the counter. Now, those vary in duration of their effect and also side effects. So some cause drowsiness and some do not.
Okay.
Then we have corticosteroids. Nasal corticosteroids are the best treatment for allergic rhinitis. Most are prescription form. There is one kind over the counter. Kids tolerate this well, adults tolerate it well. The third category is nasal decongestants. So those come in sprays or pills, but if you use a nasal spray, then you only need to use it for 3 days. And then the final one we use are allergy shots. Now these are for the most severe cases, ones where people can't get away from their allergies or they've tried everything else first.
Okay. One thing I get confused about with allergies, sometimes I think, oh, okay, is it an allergy or do I have a cold coming on? Is something viral? How do you know the difference?
Absolutely. Typically, you'll run fever with viruses. Allergies have milder symptoms. If you have more severe symptoms, you should always contact your provider.
All right. Thank you so much, Callie. Good to see you
Absolutely.
again.
Nice to see you too.
Right.
Thanks
Good
for having
information.
me.
Yeah. And so the mold spores, I assume with all the rain and the damp weather, it's probably kind of bad out there, isn't it?
Absolutely.
All right. This is at CHI St. Vincent Family Clinic in Sherwood and Scott. The phone number is 501-552-7262. If you have any questions for CALLIE FLETCHER, you can contact her at that phone number, 552-7262. I'm burnt out, and I'm burnt out on allergies.